right, welcome everybody. Thank you so much for taking the time to listen to us today. We are in great pleasure of having Dr. Marie-Hélène Boudrias with us. Would you like to introduce yourself?
Hello, my name is Marie-Hélène Boudrias. I'm an associate professor at the School of Physical and Occupational Therapist. I do a lot of clinical projects, but I'm also a neuroscientist, so I'm happy to be here to answer your question today about telerehabilitation.
Yes.
Good.
So, knowing your background in neuroscience and neurology, of course, how do you see, have you seen any recent advances in telerehabilitation, or how does your background help you understand telerehabilitation more?
So first, I wanted to use that technology, telerehabilitation, in the context of rehabilitation back in 2017, and at the time we were trying to get funding from different agencies. And the answer we would get at the time was, it's too dangerous, it's out of our practice, you're not allowed to evaluate someone, an individual, without real contact. So we had a lot of trouble to get the funding to start that project. So we ended up not doing it.
Okay.
So then when the pandemic of COVID-19 hit, then we were prepared because we already had a project, so we could submit this idea again, and then this time we could get funded and start using that technology in the context of our research project.
Interesting, okay.
We see that you started your research in neurodegenerative diseases, but later shifted to the impact of at-home post-COVID discharge. Like, why did you change your focus to this area?
So it's not exactly that. So I've started as a clinician, as a physical therapist. Then I went on to do graduate studies in neurophysiology and then neuroimaging. So as there was not much we could do in person, and there was this call.
Right.
So we do it because I train also physical therapists and occupational therapists. We need to have clinical projects, so keep ourselves busy and maintaining a contact with our stroke participants. So that was an easy or something that kept us busy during the pandemic.
Okay,
Yeah.
so could you say almost that the advancement in technology and rehabilitation is really what created this opportunity for you to have this completely new job?
Definitely. Yeah.
Okay.
Yeah.
See, that's very interesting, because I guess it's one aspect that we didn't really cover about telerehabilitation, is the amount of obviously jobs that it offered during the COVID pandemic. So that's very, very interesting.
Yeah, the ethic committees that give us the seal approval for doing research. At the time, they were not, in 2017, they had a lot of apprehension and they were really concerned about safety. But with the pandemic, I think some of this fear went away because there was nothing else.
Right, exactly.
So it provided this opportunity to open up, and then and now, I mean, I definitely see telerehabilitation as an additional tool we have in clinics. It's just one more tool. It's not the only tool, but one more tool.
Right, okay. And to be able to accommodate so many more people, it's great to have an extra tool.
I think, as a physical therapist, and I think it's the same thing for occupational therapy, we need to have a contact. We need to see other person move or the person interact in its environment in order to create a treatment plan. But a lot of these treatment have to be done by the participant or the patient or the participant, the individual at home or on their own. So to accompany this process, telerehabilitation is really good.
Right.
Yeah. But you have absolutely to keep the real contact. But it's an additional tool that you have.
Okay, understandable.
Yeah. Because what is in the center of telerehabilitation is consent and privacy.
Yes, that's definitely
So-
one of the issues that have come up in terms of worries and questions.
Yeah. Are you being recorded? You're at home. Can this information being used?
Yeah.
In terms of maybe insurance coverage, exposing your fragility, and also consenting virtually was also something new in my practice. So now I think it's fine, and I think it's acceptable. I mean, they had to adapt to this insurance company.
Right, exactly.
But it's very interesting that in 2017, for instance, I'm sure they would have said no.
Oh yeah.
So to me, the pandemic was really an event or a situation that pushed us to change.
Right.
And then that we can change and we can adapt, and sometimes we have resistance, but when we're pushed, we can address.
Push comes to shove, it has to happen.
Yeah, and then things...
Since you talked about COVID, do you think other factors also caused this major paradigm shift in the field of physical therapy?
I think one factor that is very important is the lack of professional in the system at the moment. So I think it's a way to see more people, and it's a way to also maybe have more equal or access. I think that, and I think we're doing a lot. We're discharging very early on now, the participant, let's say after orthopedic surgery or after a stroke. So if we can accompany the discharge with telerehab, then it makes it more efficient to have people back to their home earlier. So yes, it helps to facilitate earlier discharge and allow continuity in the continuum of stroke or physical health programs. Right. I know that now there are definitely programs where it's embedded in the post-care continuum that telerehab or telehealth also are part of the discharge process. So you're not entirely discharged, but the continuum of care is done through rehab. So you're not discharged, you're still under in a program, but with being managed remotely. Remotely. Okay. But always with outpatient follow-up too. So it's never, and if there's any problem, then also we need to have the possibility to act rapidly to get the person back into a real person environment.
Exactly. I was wondering if all, or at least most clinicians are comfortable with online physical therapy. Like I believe some of them would not provide online therapy, but would only provide in-person therapy. What is your opinion on that?
I think there might be a difference between what happened within rehabilitation center or if you're discharged from the hospital and that is part of the continuum of care. I think maybe the problem could be if you work in a private clinic and then insurance are not covering as much or they don't give as much. So maybe it become a financial burden that you're not receiving the same financial support if you're doing it remotely, because there's responsibility. Whatever you do when you provide, you evaluate or you treat, it comes with the responsibility. We're part of professional order, so I can imagine that some are not comfortable with that because they don't feel that they provide a secure treatment or a secure environment, and I can imagine that people are not comfortable with that. And it's not everyone that is familiar or comfortable with technology. And that it's not because you're young that you're not comfortable with it, or it's not because you're older. Or so I think that can be a barrier, and we need to not penalize people that are not comfortable with it or that don't. And
Thank you so much. This is like so interesting to see, because of course we're trying to do our research, looking at articles and stuff, but it's so interesting to talk to a person who actually has been in it. And of course you said you've had projects, you've been part of institutions, so it's just really interesting to get this new perspective on the problem, on this event that's going on almost, it's kind of evolution.
Yeah, thank you. But I think it's always from the point of resistance, my own resistance and other resistance, and I think, more we're going to know, we're going to demystify that there will be research that will show that it's feasible, it's safe, and I think more we're going to use it, and more we're going to even use it in a better manner, because there evolution with maybe sensors that we're going to use later on, which will allow us to do like real-time measure or speed, and I think there are different ways where we can improve also its use with technology that improves along the way. So it's not a stable modality. It's going to evolve and it'll be fun in a way. So that's what I try to think, that we don't have to resist, but we need to see what's the best use we can do with it.